Welcoming you all, Critical Incident Desensitization Protocol, CIDP today. Protocol helping to practice bilateral stimulation. We are delivering this bilateral stimulation practice every day, twice a day, for survivors affected by wildfire related trauma. Vividness is something that focus to reduce in this session. The traumatic experience of wildfire related crisis bring so much vividness. The goal of this session that we providing by IMC Northern Manitoba, our goal is reduce the vividness and help client to deal with their trauma more positively. So having a comfortable seat, we're going to practice the protocol today. And again, this is not therapy, this is not counseling. You still can take your therapy sessions, your counseling session. We call this, and this introduced in first responding world as a CPR, emotional CPR. So CPR for emotional support. So again, you can access your professionals when you need, and all we're doing is we're helping to reduce the vividness. So have a comfortable seat. I will guide you through the protocol. So let me guide you step by step. I will ask you to upset your level of upset, and I'm trying to measurement your level of upset by scaling 0 to 10. 0 is not at all, 5 is somewhat, 10 is a lot. So, or if you cannot scale your level of upset, your level of vividness, you can always scale is by somewhat, not at all, or a lot. Okay, 0 to 10. So again, please make sure that you are aware of these scales, and you don't have to repeat it. You can write down in a small paper, or you can keep it in your mind simply. Okay, and let's start the grounding technique, becoming more aware of your breathing. Inhaled, hold your breath and exhale. Inhaled, hold your breath and exhale. Inhaled, hold your breath and exhale. Inhale, hold your breath and exhale. I'm going to do counting breath and hold. When I count 1 to 4, you're inhaling. When I'm counting 1 to 5, you're holding. And I'm counting 1 to 6, you're exhaling. Okay? Inhale, 1, 2, 3, 4. Hold your breath, 1, 2, 3, 4, 5. Exhale, 1, 2, 3, 4, 5, 6. Again, inhale, 1, 2, 3, 4. Hold your breath, 1, 2, 3, 4, 5. And exhale, 1, 2, 3, 4, 5, 6. When you practice this technique, it's better to do this couple of times and giving more calmness by calming your sympathetic nervous system. And what we're using is a bilateral stimulation. That's what we're using to reduce the vividness. I prefer tapping bilateral stimulation by tapping butterfly crossing and your left and right side, left and right, always left, then right. Every time you tap your left side, you're making your attention to left and right, then you're letting your attention to go to your right side. So this way, your eyes starting to move automatically, right, left, right, left, right. Okay. So let's do it a couple of times. Left, right, left, right, left, right. Be more comfortable with this tapping, and try your best to engage the tapping. And more you feel comfortable, you can change the speed. You can tap slowly, or you can tap with certain rhythm. It's totally up to your comfort zone. So again, there is no exactly speed. It's all based on how much you get involved and along with this. So if I have your permission, if you feel comfortable, and this is something that you can try, there is no any side effect still finding in emotional CPR. If you your answer is yes, I'd like you to join. You can stop tapping when you feel the previous memories and headaches or body sensation, discomfort or clumsiness or any other feeling, especially any past trauma comes across, or you feel uneasy, discomfort, please stop tapping and following the protocol. Okay, and more upset or more incident, you're not really following the protocol, you can stop and keep a little gap and then try it again. Okay, and I'm asking all of you to think of the incident, apply 10 rounds, take a breath, hold your breath and let it out. Think of the incident. How much does it bother you? 0 to 10. Or not at all, somewhat, or a lot. Find your number, simply go with that. Think of the incident, apply again. Take a breath, hold your breath, let it out. Think of the incident. How much does it bother to you? 0 to 10. Or not at all, somewhat, or a lot. Find your number, just go with that. Think of the incident. Take a breath, hold your breath, think of the incident, let it out. How much does it bother to you? You can always apply 10 rounds when you're tapping, 10 rounds. That means 20 amount of tapping. If you feel your eyes are getting along, keep the 10 amount. If not, you can always find the number 5, 6, 7. It's all again based on your comfort zone or how much you feel this working out for you. Okay, if you find the numbers are getting down, that means your eyes are moving with the bilaterally, the technique is working. Okay, think of the incident. Take a breath, hold your breath and let it out. Think of the incident. How much does it bother to you? 0 to 10. 4, 5, 3, 2, not at all, somewhat, or a lot. Okay, just go with that. Again, 10 round of taps. Take a breath, let it out. Think of the incident. How much does it bother to you? If the techniques is working, if you're engaging with tapping every time you tap into your left, right side, you're moving your eyes, you're letting your eyes to follow up your tapping. It happens automatically. You feel this is responding and coming down. Your vividness, your anxiety is coming down. Okay, so we don't recommend more than 10 amount of tapping, 10 rounds for each, for 10 times, not more than 10 times. Our experience basically it needs to be worked between 4 to 5 times, not maximum 6, not maximum 10 times. So before you ending, make sure you have people helping. You're talking to your therapist or your counselor. You're taking some spiritual resources. You have comfort people in your life. You have a lot of support in your life. You're taking all the other first respond protocols and support. And so that's all about today meeting. And this is something that you can review with your family, sit down with your family, your friends. You could practice again. It will give you some support and relax. More information regarding CIDP and ATAP, our ATR, the Acute Trauma First Responder Training. You give us a call, Integrative Mindfulness Center, IMC Thompson, or shoot us an email and join our training. You have a wonderful day. Talk to you soon. Bye for now.